This medication is prescribed for individuals with severe kidney disease who produce excessive amounts of a certain natural substance called parathyroid hormone, PTH. Elevated levels of PTH can impact the balance of other minerals in the body, such as calcium and phosphorus, which are crucial for maintaining strong bones. Calcifediol is classified as a vitamin D analog and functions by reducing PTH levels while increasing calcium and phosphorus in the body. It helps in maintaining bone health and mineral balance. The recommended daily dosage and the optimal time to take this medication should be discussed with your healthcare provider. When taking Calcifediol Capsule, extended release 24 hours, it's important to follow your doctor's instructions. Typically, you'll take this medication once daily at bedtime, swallowing the capsules whole. It's crucial not to crush or chew the capsules to avoid releasing too much of the drug at once, which can increase the risk of side effects. Your doctor will determine the dosage based on your medical condition and response to treatment. To minimize the risk of side effects, your doctor may start you on a low dose and gradually increase it. It's important to follow these instructions carefully. Taking this medication regularly is key to getting the most benefit from it, so try to take it at the same time each day to help you remember. If your doctor has recommended a special diet, such as one high in calcium, it's crucial to follow it to get the most benefit from the medication and prevent serious side effects. Additionally, do not take other vitamins or supplements unless directed by your doctor. Calcifediol typically has very few side effects. If you experience any unusual side effects, make sure to contact your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. If you do experience any serious side effects, such as bone/joint/muscle pain, loss of appetite, nausea/vomiting, constipation, increased thirst, increased urination, fast/slow/irregular heartbeat, or mental/mood changes, be sure to inform your doctor immediately. Although a very serious allergic reaction to this medication is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed here, make sure to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, and you may also report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects, and report any side effects to Health Canada. Before starting Calcifediol, make sure to inform your doctor or pharmacist about any allergies you may have, especially to vitamin D products. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to discuss your medical history with your doctor or pharmacist before using this medication. If you are planning to have surgery, inform your doctor or dentist about all the medications and herbal products you are using. If you are pregnant, only use this medication if it is absolutely necessary and discuss the risks and benefits with your doctor. It is unclear whether this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Calcifediol Capsule, extended release 24 hours. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with this drug is burosumab. Also, do not use medications containing other forms of vitamin D while using Calcifediol. As for the benefits, daily dosage, and optimal timing, it's best to consult with your healthcare provider for personalized guidance. They can provide you with the appropriate dosage and the best time to take this medication for your specific needs. If someone has taken too much of this medication and is experiencing severe symptoms like loss of consciousness or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with anyone else. Your healthcare provider may also schedule lab or medical tests, such as PTH, calcium/phosphorus, and vitamin D levels, while you are taking this medication. Be sure to keep all of your medical and lab appointments. If you happen to forget a dose of Calcifediol Capsule, extended release 24 hours, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. It's important not to take a double dose to make up for the missed one. It is important to store Calcifediol Capsule, extended release 24 hours at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. For guidance on how to do this, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.